Hi, I'm Leanne Slow and I'm a registered nurse. I'm a midwife and I'm a child health nurse and I work here at Gladstone Community Health. This year I'll have been nursing for 43 years and I started as a student nurse in South Australia in Whyalla, and I worked there until I registered. I did about 18 months postgraduate and then we went on a working holiday and we got to Queensland and we stayed here for a while. I've worked here at the Gladstone Base Hospital, worked in Rockhampton, both in the public and private sector, and then we moved out to Blackwater, worked out in the Blackwater Hospital for a while, for 9 years actually, and then I did my midwifery training in Rockhampton when Rockhampton flooded in 1990. So we had a lot of fun going to work in the boat at times. And then when I was in Blackwater, I started my child health once I'd registered as a midwife. And then we moved to Gladstone and I worked in maternity here in Gladstone for 4 years as a midwife. And then I consolidated my child health training and started down here in child health in 1996. And I've been here since then. I think I've always wanted to do midwifery, but when I worked remotely, you actually had to have someone on call if you weren't a midwife, so you relied on other people to help you do your job. And we were able to birth mothers in rural areas at that stage, so it was quite a deficit not to know anything about looking after pregnant women and helping them through that part of their life. So it was sort of like I felt like it was a calling, so I did that. And then I guess one thing leads to another, and you think, well, what happens to mothers and babies after the baby's born? You know, who looks after that? So then there was the child health component, and that training was offered through Central Queensland Health, and there were about, I don't know, probably 15 or 20 of us that actually started doing that course. And then as families do and work commitments happen, so we relocated to here, and I finished that and consolidated it here, and have learnt so much by being a child health nurse. I thought I knew everything when I became a nurse and then a midwife, but I realised when I came down and started working in child health that I actually knew nothing. So it was a big learning curve. I'd already had my children before I became a midwife, so all of the after pregnancy and child health stuff came after I had my children. So my children were really quite little when I started my midwifery training, and because we were remote, I had to, and I was only working part-time in a country hospital, I had to prove that I could study and work full-time with 3 little kids, which they wouldn't be able to get away with now. But I had to work on top of being away for 12 months. I had to do another 3 months full-time on top of that before I started my training to prove that I could actually work with little kids. Wow. So that made a very long 12-month course. Yeah. And during that time, our family relocated to Rocky for half of that of my training, and then when the school year started, then they moved back to where we were going afterwards. So I had my children before I did my mid and before I did child health, and it would have been really good probably to know what I know now. Yeah. when my children were little. So when I started nursing, we called it earning your stripes. So nurses started off, your first 6 weeks you didn't have a cap. It was our preliminary training, so PTS. And you did a study block and you just wore your uniform, and in South Australia our uniform was lavender pinstripe, this colour, and we had really thick purple stockings with our black lace-up shoes with our really short haircuts, and our uniform had to be below the knees, so it was pretty strict. And once we got out of PTS, we actually earned our cap, and we had our starch cap. We got 2, and you had to look after them. And they were pretty well useless, apart from being a status symbol for how far you'd gotten in nursing. So at the end of your first year, you earned your first stripe, and that was proudly put on your cap. At the end of second year, you got your second stripe, and you were aiming towards a registered nurse who had a veil. And by the time we actually got there, the veils and the caps were obsolete. So we didn't actually get to use we can get a sister's cap or a registered nurse's cap. But the caps were quite inconvenient. They did hide messy hair if you had messy hair, but when you were lifting patients, when you were crawling under beds, when you were doing dressings, they always got knocked off. And very young, we were very young. So there I am with my 2 stripes just before I finished my nursing. So just pop it on. People wore them in various ways, but it was meant to sit up the top here, and you just pinned it on with a couple of little pins. There were some girls that were a bit adventurous and they'd sort of wear them down here when, despite not having a registered nurse one, when we graduated as a midwife, we actually wore a paper cap, which is very Florence, and also had a navy nurse's cape on, which was usually a woolen, very heavy garment, very hot, or good for cold nights, but you were never allowed to wear them when you were on duty. So it was only for going from your living quarters or your car to work or afterwards, or to dinner. A big group photo when we graduated as midwives, and this was in Rockhampton in Scotia Place in 1991. Very hot, it was really hot. And this was a group of nurses who'd gone through midwifery, general training, enrolled nurses, and we were presented to the then Director of Nursing, Matron Norma West, and she'd been there for a very long time. When I was a little girl, I think I was about 5 or 6, I was really sick, and I spent 6 weeks in hospital, and I was pretty well looked after by the nurses a lot, and I can remember being piggybacked, because it was a country hospital, piggybacked around the back garden, going and picking veggies out of the garden to take into the kitchen and use for the food that was being prepared for the hospital. And these nurses were lovely, and I thought, I want to do that. I want to be a nurse. Yeah. So I had nephritis, which is really a severe form of kidney infection, and I was quite sick. So yeah, that was, I think, the starting point, and after that I was always going to be a nurse. Yeah. Like I said, when you become a registered nurse, you think you're pretty empowered by that. You think you're pretty good, and it's really nice looking after people across all ages. And when I did my training, we were in quite a big teaching hospital, probably about the size of Rocky, and we looked after everybody. We did all areas of nursing, so paediatrics, surgery, aged care, male and female medical. What else was there? Theatre, accident and emergency, outpatients. I really enjoyed working with the male medical model. That was really good. That was a nice learning curve for me. And then when we travelled, I did a lot of casual stuff when we first come here. I did like specialing in intensive care, that sort of thing. And then when I became a midwife, it was really lovely to work with women and support them at the most vulnerable and probably special part of their lives. It was quite humbling to be a part of that, and then you think, what happens after that? So working with families, I think. So midwifery is working with women, and I think child health is working with women and families, because a lot of what we do is working with families. Yeah, I think the beauty of child health is there's nothing that is the same every day. You know, you could have a heap of people that you see in the morning that are supposedly with the same sort of bookings that you're seeing them, you know, like they're coming for a health check with vaccinations, but everybody's different. We do home visits, we go out and visit parents at home, and we're not there to be critical, we're there as a support person, and we actually I think our role is to link families into the resources that are available in the community, because until you have a baby, we're really competent, well organised. We got ourselves together as adults. We can manage jobs, we can multitask, we can be organised, we can be somewhere 5 minutes early. But when we get this tiny little baby and we go home, we've suddenly got this little person that we're supposed to know how to care for, and all of the information out there in the world, the instant technology that's at people's fingertips, doesn't really tell you how real it is and what's normal and what's not. So the media portrays motherhood as you're glamorous, you're beautiful, you're immaculately dressed, you get lots of sleep, and babies just know what to do and they have a feed and go to sleep, and you can have a fabulous life as well. But the reality is these little babies don't know any of that, and what's normal for them might be different to what's normal for somebody else's baby, and they're the mother that's baby sleeps all the time, so that's normal for them. But this baby's a little high energy baby and they need to feed more frequently, but that's also normal. So trying to normalise individually to empower parents to have confidence in their ability to do a brilliant job at raising their own little people. I think we have a lot of opportunity to actually be there and work with that family. So it's not that we know everything, because we certainly don't, but it's about letting families know, letting mums and dads know that they are doing a great job, and this is really normal for your baby to be like this, and it does get better.
Yeah.
And if it doesn't, then there's places we can refer you to, or we can come and see you more and work closer with you, and hopefully make that transition a bit smoother until they get to a point where they're quite empowered and confident in their ability to be a mum or a dad. And then off you go. We're here if you need us. You're doing a great job.
Yeah.
Well, when I first came here, we had another child health nurse who'd come from Western Australia, and she noticed that there was nothing for mothers. And there was a model in Western Australia that she'd actually used and brought that over here and introduced that. And that was, over the years, it's had lots of names, but it's trying to be an inclusive group, because as we know, parents aren't stereotyped. They can be young mums, they can be mature mums, they can be step mums, they can be adoptive mums, they can be same-sex couples now. So it's about linking families together to let them have common ground and a safe place where they can information share, and they can actually be proud of who they are and grow, because they're parents. They're not someone's workmate, they're not someone's brother-in-law or sister-in-law, but they form together a bond because they are parents. And it's quite socially isolating initially, because you have got that little person that isn't very time aware, and I've got to be here at 9 o'clock and I've just decided I want to have a feed and I've had a poonami and I've just got to change my clothes before I get there. It doesn't matter if they come late. The important thing is that they actually they can make it. So we rolled it out in that everybody's welcome. Grandparents, if that's who you need to bring with you, bring grandparents. They're getting the same information as what you are at the same time, and that's supporting you as a parent. So dads can come too. So yeah, anybody that's a support person for that new parent. Over the years, it's definitely had lots of name changes. So it was Mother's Group, but then you think, well, sometimes it might not be a mother, a biological mother. It might be a grandmother that's got the child, or it could be a dad, and there's nothing around for dads either. So the name has evolved. So Mum's Group, Mums, Dads, Grands and Bubs Group, and to First Steps as well. So it is still affectionately known as Mother's Group or Mum's Group. I think that's probably Australia-wide or worldwide. But as you know, these groups continue to meet and they have lasting friendships, and some of these mums and these kids are still connected 20 years down the track, 16 years down the track. So that's really good. And that's the purpose of it. It's about networking mothers or parents together because you are parents with children of similar ages.
Yeah.
The age group that we look after, so from our mums are somewhere from 15 to 45 pretty well. And a lot of people come here to Gladstone to work. So we've got a huge diverse population of affluent people, multicultural people who've actually moved away from their family support networks, and they come here, and we've got a really, really minimal public transport system. So if you don't drive, you're really hindered by isolation. You can't get anywhere. So to network these mums together in some format is really important, because I think it empowers them to strengthen their own resources. But it's quite isolating. That a lot of the dads work really long hours. A lot of them are drive in, drive out, or fly in, fly out. So for a big part of the working week, these mums are single mums until dad comes home. So their normal support networks aren't there. So you've left everything that you know to come here, and it's an industrial town. But there's so many resources here, and unless you actually know how to get into them,
Or can get to
them, you're really isolated. So I think the system that we have, which is really, really good, is you have your babies in the public hospital, have your babies in the private hospitals in Rocky or anywhere else in Australia. These mums can be referred to child health, and then we can home visit them. So we can go out and visit them home, help them establish breastfeeding. If you have your babies here in the public sector, you have the extended midwifery service or midwifery group practice, and then they link into child health after that. And we can form a longer term relationship where you have the same child health nurse that cares for you right through until at such stages the babies are doing really well, or parents have made those social connections and are really independent and doing, growing strongly, and then we step back. So I think it's a really good service.
Yeah.
Really, really powerful service. And it's really nice to be part of a family and to watch people grow up, watch these kids grow up, and to often now you're getting people come through and you go, were you there as a midwife? Or I remember you were here when I had my little baby. And some of these children are coming through and having children now too. And they'll go, you looked after us when we were little kids, and now we're being parents too.
Yeah.
So it's really nice doing that.